So you've been peeing quite frequently, especially at nighttime, and you're worried that you might have prostate cancer. But before you consider prostate cancer as a possible cause, why not think about other causes? So if you're a man, obviously you've got prostate, you might be worried that, oh, okay, I don't normally pee at night, or maybe you pee once at night and you're peeing 2 or 3 times more frequently than you used to. And the first thing that comes to your mind is this prostate cancer? So what are the symptoms of prostate cancer? So prostate cancer can present with lower urinary tract symptoms, such as, peeing at night more frequently, or peeing during the day more frequently, difficulty, passing urine, not passing urine as much as you used to. Maybe you've got a poor stream of urine. You might notice maybe there's some blood in your urine as well. And apart from urinary symptoms, you can have other symptoms such as blood in your semen, which is a red flag. Back pain is another red flag. Weight loss is another red flag symptom. Fatigue as well is also a sign that, okay, this might be prostate cancer, as well as bone pain. But also note that some people with prostate cancer do not actually have any symptoms at all, and is an incidental finding when you do a PSA test. Or you might just have one symptom which might not tell you that it's prostate cancer, but it's just a change in your urine, like peeing at night more frequently than usual. So other causes to think about, apart from prostate cancer, could be you could have an enlarged prostate. So an enlarged prostate, is what we call a benign prostatic hypertrophy, BPH. That can also cause symptoms where you pee at night quite frequently, but you notice that you're passing smaller amounts of urine, or you might notice hesitancy where you're not passing as much urine as you would like. You might also notice poor stream as well, where the urine does not flow as much as it used to. These are signs that this might be benign prostatic hypertrophy. Also, if you're going to see the doctor and examine your prostate, they might notice that your prostate is enlarged and smooth. Whereas with prostate cancer, it tends to be more, irregularly shaped when your doctor examines your prostate via what we call a digital rectal examination. So another cause of peeing at night more frequently could be your lifestyle. Are you drinking too much fluids or water, especially just before you go to bed, or throughout different times of the day? Are you taking caffeine, drinks like coffee? Are you drinking, alcohol? These are drinks that will stimulate your bladder to make you want to pass more urine. Also, are you on medication like furosemide, for example? Furosemide is a diuretic, used for people with swollen ankles or high blood pressure that can also make you pass urine more frequently than usual. So that's another thing to consider. Also, especially in young men might have what we call an overactive bladder, where basically your brain is not really getting the signals that your bladder is not completely full. So you're peeing more frequently than usual because your brain thinks that your bladder is full. And another condition to consider with peeing at night is diabetes. Diabetes, especially, type 1 or type 2, have symptoms of, increased thirst at night. So you're drinking more, peeing at night more frequently, feeling quite tired. So these are symptoms of diabetes to consider as a possible cause of peeing at night more frequently. So if all these causes have been eliminated and you're now thinking, is this prostate cancer? Your doctor will now do a test called a PSA test. As I mentioned, you also be examined for your prostate. However, a prostate examination is not always reliable because it depends on the size of the finger. It is quite a subjective test as well. If it's a female finger compared to a male finger, there will be differences in examination. So a female finger might not be able to reach the prostate, while a male finger might be too large, to fill the whole of the prostate. So if your doctor does a PSA test, which is usually done a week after you've done a digital rectal examination, because if you do the PSA test shortly after you've done a rectal examination, you might have what we call a false positive. If you've done a PSA test, if you've got a urine infection or you've been doing some form of exercise or intercourse 48 hours before the test, you would have what we call false positives as well. So the timing of the PSA test is very important. So usually the PSA test comes with values according to your age range. So depending on your age, if the value is higher than normal, what your doctor would want to do is either consider repeating the PSA test, or if this is highly suspicious that it could be prostate cancer, your doctor will now be referring you to a specialist for further examinations, such as having a prostate biopsy, having an MRI scan, or having an ultrasound to determine is this prostate cancer. And also the treatment for prostate cancer will now depend on what type of prostate cancer you have. Is it slow growing cancer or is it fast aggressive prostate cancer? In terms of treatment, there are different options such as surgery, radiotherapy, immunotherapy, and this all depends on a discussion between you and your surgeon, depends on how advanced your prostate cancer is as well. But usually if the prostate cancer is caught early, treatment is usually quite successful. So if you have any symptoms, whether it's peeing at night or difficulty passing urine or back pain or fatigue or bone pain or blood in your urine or semen, please see your doctor straight away.